Hello, I'm Dr. Surindher. I'm the Director of Cosmesis India. We are based in Brigade Road in Bangalore. We often get a lot of queries from our patients asking for what are the reconstructive options when it comes to the foot. The foot is a very unique structure in the body. The problem being in the foot is that it doesn't have enough soft tissue cover. It doesn't have muscles there. Most of the foot is made up with bones, small muscles and tendons which are connected to the muscles in the leg. What happens because the foot is prone to injury, it is prone to so many injuries, it is prone to shoe bites, it is prone to, and diabetes affects the foot. So the injuries to the foot and it can be run over in accidents, and that is the most commonly injured part in the lower limb. So coming to that, you need some reconstructive options for the foot. The reconstructive options in any area in the body and in plastic surgery are what we call a reconstructive ladder. It goes from the simple to the most complex. So the simplest or the most simple form of reconstruction that you can do when you have a wound on the foot is the skin grafting. The skin grafting is once the wound is clean and red, what we need to do is take a piece of skin from the thigh and we fix it onto the raw surface onto the foot, and that covers the wound. That gives you a coverage for the raw areas or the tendons which are exposed. But as I mentioned before, because the foot doesn't have enough soft tissue cover, doesn't have enough muscle there, and it is usually the bones, sometimes the bones and the tendons are exposed. Once the bones and the tendons are exposed, you cannot cover it with normal skin graft. It will not stick there. So then you need to do something more extensive. Then the next step in the reconstructive ladder is something called a flap. A flap is basically a piece of skin which is full thickness, but it has its own blood supply. So it has to be attached to its blood supply during the healing process, and hence that flap has to be taken from somewhere surrounding the area of the injury. So if the injury is in the foot, then we take the flap usually from somewhere on the leg with its own blood artery which is supplying it, and then once the wound heals, we divide it and we set it back. So this is called a local flap where it is attached. The topmost or the most complex reconstruction that you do on the foot is something called a free flap, which is basically a free tissue transfer or a reconstructive microsurgery. In that, what happens when you don't have tissues which are in the vicinity of the injured area, which you can rotate in a form of a flap and cover the wound, but you want to save the bones and the structures which are there, then what you need to do is you have to bring a large chunk of tissue which has muscle, skin and its own blood supply, has to be taken from another area of the body, usually from the back, which there is a large muscle called the latissimus dorsi. We take that along with its skin and then we put it onto the foot, and then with microsurgery, the arteries or the blood supply to that flap is attached to an artery in the leg. So that is your most complex reconstruction that you can do for the foot. Of course, where it is needed will all depend on the complexity of the injury and what kind of an injury and what are the structures that we are trying to save, and of course the general condition of the patient. So considering the reconstructive ladder, the simplest is a skin graft and the most complex is a microsurgical reconstruction of the foot.